So imagine my surprise when I was called the N-word by a patient. What I'm about to say is going to shock a lot of people. So as far as I can see, the NHS is black. 2020. What a year it's been. The coronavirus pandemic, the death of George Floyd, the US elections, some momentous times. It's where underlying tensions erupted, exposing the inequalities in health and wealth. It was a year of mixed messages, from herd immunity to social distancing, firebreakers and circuit breakers. I've worked in the NHS for almost 10 years. I love it. It's the best part about this country. But I remember when the NHS was tested like never before, when 1,000 people were dying in the summer of 2020. Key workers stepped forward, from transport services, utilities, food processing, many others, and of course healthcare. But who were they? In 2019, one estimate was 12% of key workers were from ethnic minority groups in the whole of the UK. Coming to London, it went up to over 30%.
This brings me to the last question. I know we've worked together for some years, and one of the things I think that's wonderful, particularly about emergency medicine, is you have doctors from all kinds of backgrounds, from the nurses as well. I want to say some of the Filipino nurses are incredible. I think England has so much to be thankful for to the Philippines. To their healthcare assistants, to the British nurses, to the African nurses, to Muslim, Arab, Pakistani, Indian doctors, whoever it may be, whatever race they're from, whatever position they hold, they're very much valued. And I think in the events of 2020, going into the future, I think more now than ever we have to pull together. And I just wondered, maybe in all of your experience, because I know you've worked across the country, if you could tell me what you think about the multiracial makeup of the NHS and what it looks like going forward.
I knew this before I went into medicine, that because I could see it from where my father worked at Broadmoor Hospital. One of the things I like best about my job is the fact that I meet with and work with people from many different cultures. I work with Japanese people, Bulgarians, Russians, Romanians, Spanish, you name it, I've worked for them. Egypt, Nigeria, South Africans. I think that brings a really wonderful element into our profession, and medicine is probably more multicultural and multinational than any other industry apart from the airline industry, I would say.
My first risk assessment came in around August 2020. Too little, too late, I think. I'm not a fan of the term BAME, but let's use it for this. One report from the British Medical Association illustrated some alarming statistics. 21% of all staff were BAME. 63% of healthcare workers who died were BAME. 20% of nursing staff are BAME. 64% of those who died are BAME. 44% of medical staff are BAME. 95% of doctors who died are BAME. The NHS's Confederation of BME Leadership Network said institutional racism and economic inequality were at the root of all of this. A survey of 100 members of doctors said that over 80% believed that staff did not speak out when it came to race and the coronavirus.
Another question I wanted to ask was something that I think is wonderful about the NHS is very much of a multi-ethnic makeup. I know you've seen the NHS at work, and we've worked as well in Africa. So in terms of that, if you could just tell me a bit more, I mean, Canada is celebrated for having such mixed heritage and for celebrating its diversity as well. If you could just tell me maybe what your experience in Canada and of what you see in England of the NHS are in terms of the multi-ethnic background of the staff.
That's a tricky one to answer, because of course with Brexit, our politics around that are very, very different. I do know that, we really value our healthcare providers who have, maybe trained in other countries and have come to Canada to work. And, they definitely add a lot of value to the healthcare system and to society in general. I don't know. That's a tricky one because I'm not on the ground in the NHS on a day-to-day basis. But from the perspective here, it just seems like, with Brexit, I think that the NHS will only be at a disadvantage if health, physicians and nurses and midwives are discouraged, or if it's just been made impossible or next to impossible for them to go and work in England. I understand about a third of the NHS workforce were trained in other countries, which I might be wrong. You can correct me if I'm wrong, but that's the latest stat that I've read. And I just think it's going to be so unfortunate if Brexit impacts on that diversity within the healthcare workforce.
Let's turn our attention to Dr. Susan Moore, a black physician who died because of the coronavirus. A few weeks before her death, she said she had racial inequality in her treatment. She said she had to beg for treatment in one place. In another, she said the doctor did not listen to my lungs. He did not examine me. He did not take account of my pain.
I know we've known each other for a couple of years now, and we've had long chats about race and politics and religion, and the COVID pandemic has thrown all of that to light. So maybe could you just tell me, on your experience on the ground in Philadelphia in America, how COVID has affected the average African American and where you are within all of that too?
Okay, so, the COVID crisis, in particular with the African American community here in Philadelphia, has been challenged just like all the other communities. Probably more acutely because of the, inability to access testing. And that was a big problem in the beginning, that African Americans couldn't get tested because there had all these barriers. So there was actually a group of Black doctors and the Black Doctors Consortium. We actually had this group come to the mosque. They were a mobile unit, 35 Black doctors and nurses, and they set up a mobile station where the neighborhood where the mosque resides, they could come to the mosque, they could drive in a car, they could stay in the car to get tested in that regard. They could come up, they could walk up and sit down in a chair and get tested. And then the results were, given to them a couple of weeks later. So that was one of the hurdles that we had, was getting people tested. And so I think that was the biggest hurdle initially in regard to the testing.
What was the institutional response to this? The Public Health of England put together a report. There were 7 points. I read an analysis that actually prompted me to make this video. One analysis said it did not offer anything new, only long-term strategies. The same writer said there was a lack of ownership. There seems to be an abundance of words, but a lack of decisive, clear guidance. Once again, immigrants are called to save the UK. We've always been here. We're always going to be here. We've done it time and time again, and we'll carry on doing it. From World War I to the immigrant rush, to now, where we front national institutions and the key services. From the corner shops to the petrol pumps, from the buses to the hospital, BAME staff are on the front line. This comes after decades of inequality. There are a number of issues we could discuss. We could talk about medical exams. We could talk about ethnic diversity at top leadership levels. All the more shame we have a Muslim mayor for London, 3 Asian cabinet ministers, and a prime minister descended from Turks. What I'm about to say is going to shock a lot of people, but we've been let down by our own communities.
One of the things that I wanted to talk about was specifically that I think you've probably seen it as well. I know we work in different parts of the country, is that the NHS is wonderful. I think it's the best part of this country, is that it's a multiracial mix of people. I think that's also probably what helps us get along too. But if you could maybe tell me what your experiences of that is in terms of the NHS, wonderful that different people coming from different backgrounds.
Yeah, I do think it's fantastic. I love the diversity of our country in England, and I like how you can get all people from different walks of life, from different cultural backgrounds, different religious backgrounds, different views to then come together to hopefully, almost as of one, to then hopefully fight this pandemic together.
I love this country, but I love my heritage and my faith too. NHS staff aren't superheroes. I'm not a superhero. I'm struggling through this like everyone else. And I've had my bad days. We all have. We're tired on the front line. Battle fatigue is setting in. So imagine my surprise when I was called the N-word by a patient. So as far as I can see, the NHS is black. You know, the nurses, HCAs, the bus drivers, the security, exactly. And these are some of the people that died. And just of note, I always want to emphasise, it was the immigrants, workers that died first, people who were not born in Britain, and we should pay tribute to that. Even some GPs who were not English originally, but obviously assimilated into the society.